So care coordination is set up to assist people with one of the 5 target chronic diseases, and then supplementary services is the bucket of funds that allows us to pay for specialist visits, allied health visits, and medical equipment, medical aids that are approved by DOHA. Colleen's story from where I start is that she was one of Helen's clients at Urban, North Stradbroke Island. She had been in for sleep tests and been called back to see Dr. Tolhurst, and through that meeting they were told, this is super urgent, you need a CPAP machine today.
Over the years, I considered myself being fairly healthy until anything that went wrong with me, I'd go and see this doctor in the city. Because my apnea was so bad, on my second visit, I got a letter, inviting me to go for a personal interview with Dr. Tolhurst at his private clinic at Greenslopes Hospital. And so my friend and transporter here, Helen, came along with me, and I wanted her to come in with me because if I missed anything, she could pick it up, knowing all the medical jargon. But Helen and I got to see Dr. Tolhurst, and it just blew me away. He had all the data there, and to talk the lingo that I wasn't familiar with, that I am now familiarising myself each time I meet with you, I can understand more and more. And then I can ask questions. And Helen was able to ask questions, and from that moment there, he said, she's going to have a machine tonight.
So generally speaking, her health has improved just purely due to access. She's accessing a bunch of different specialists on a regular basis, and this is leading to good results.
My family's all concerned, and they're all happy that, there's such an organisation that can give us the support. So, I just have to take my hat off, to you guys, and I need to know now a little bit more about this Indigenous urban health because, to benefit my health, because I've got multiple things. The sugar has, sent off, all the body parts have been investigated, and that's what, when you got a diabetic, that's what happens, and to have sleep apnea on top of it.
The real beauty of CCSS is the speed. You're not waiting months for things. It's a matter of, once it's been noted by GP or whoever it may be, specialists, etc., we can just get onto it. Care coordinator can give us a call or go out and purchase it, send the bill through, and we can pay it, and the patient has that in their home very quickly.
This program, I just hope it goes on, because for it to reach the communities where I've been, I just hope with all my heart that it's, they don't take it away as they do, and governments change, we tend to lose good things.
Colleen's been on the program since late 2011. She was one of the first people to be on the program for Uluburu, which is Capalaba and North Stradbroke Island. She has mainly accessed transport, as that's a big thing, especially for somebody living on the island. It's not just transport to and from an appointment, it's ferry transport, then being picked up by Helen, her care coordinator, transported to different hospitals, different settings, different clinics, different specialist rooms. It's quite an issue, access, as far as that's the big thing that makes a difference for Colleen's life. The amount of specialists she has been to is very large, as she has quite complex care needs. I think Colleen calling me her lifesaver is possibly a little overstated. I think that she's in the process of saving her own life for her own reasons and for her own motivations, and she's the one doing the hard work. I'm just assisting her to reach a goal. It's her own life that she saved. It's not particularly anything that I've done, as I see it. Yeah. I think it's important for people who aren't on the ground seeing all of these patients and their journeys and the difficulties and all of that becomes involved with it. I think it's very important for them to hear from somebody going through it what it's like and what the challenges are as they see it, not knowing about where funding comes from and how long this program's going for, just the problems that affect them individually. And Colleen's just one person, and there's many out there with differing issues, but I'm sure they can all identify on some level with what she's going through.